Okay, so let me pass to the speaker of this evening.
Hello, good evening, everyone. Thank you for having us again. Thank you for support for families. My name is Raymond. I am an advocate with Disability Rights California, and with me today is Leonie Pfeiffer. She and I will be supporting our presenter today, one of our senior attorneys, Maria Ariate. So, for those who might not be familiar with who we are, I'm just gonna do a quick introduction so we can get this started. Disability Rights California. We are a statewide nonprofit agency, and we provide free legal services to people with disabilities with any disability-related issues. We have offices statewide, and our attorneys and advocates can help with a variety of issues from access or discrimination with housing, with transportation, with education, which includes special education and higher education. We can also help some employment reasonable accommodation issues. We can also help with public health benefits, such as Medi-Cal, in-home supportive services, and Social Security overpayment issues that relates to work. And within our agency, we have separate programs, such as our Office of Client Rights Advocacy, or OCRA. They specialize in helping clients of the regional center, and our Client Assistant Program that specializes in helping clients of the Department of Rehabilitation. So we have today's presentation will be on Medi-Cal basics. You should see the two PowerPoints on screen. Everything you see today, PowerPoint presentation, along with any website links that might be put in the chat, you'll receive it after the presentation, along with the recording. And as our host mentioned earlier, questions and answer will be at the end. You can put questions in the chat. Just do not disclose any private information. This to protect your privacy. Excuse me. If you have any questions you'd like to speak to one of our advocates one-on-one, you can call our 800 number 800-776-5746, and our phones are open Mondays, Tuesdays, Thursdays, and Fridays from 9 a.m. to 3 p.m. If you call us outside of those hours, you can leave us a message and our advocates will get back in touch with you. So without further ado, I'll pass it over to Maria.
You're on mute, Maria.
Hello, this is Andres again. I'm having issues with Zoom basically freezing during the call. Could someone please assign me as interpreter for the Spanish channel once again? And I apologize for the technical difficulties.
No, it's fine. I'm going to stop the interpretation and I will start it again. So
Thank
sorry.
you.
No, it's fine. Okay, so I'm going to open the channels again. I think we are ready.
Okay, so while I was talking to myself because I was muted, I wanted to tell you guys, I wanted to spell a myth about Medi-Cal. First, you need to know that there's not one Medi-Cal program in the state of California. There are many Medi-Cal programs, and each program has its own criteria for eligibility. So when someone asks me, well, based on this, will I qualify for Medi-Cal? My best answer is apply and see if you qualify, because there's so many programs out there that you might qualify for one of them. So let's go on to the next one. So I'm not providing legal counsel to any of you, and the information I give you today may change in the future. So it's always good to double check the information you get today down the line, right? Okay, next one. So I'm going to give you some background information on Medi-Cal. Eligibility basics, because that's all I can do, because every program has its own eligibility criteria. But, I'll give it, because there are a handful of Medi-Cal programs where you have to be disabled to get on Medi-Cal. You could be a person with a disability and be on a Medi-Cal program where disability is not a requirement, right? So we will talk about some basics and some of the programs for people who are disabled, and talk about some services that Medi-Cal offers, what happens if with Medi-Cal if you have other insurance, how to apply. And I'm also going to give you, these changes have been happening in Medi-Cal since 2022. I'm going to talk about some of those. It's through the Cal-AIM initiative. And so that's the end of the presentation, and then we'll go ahead and take questions. Next slide. So let's talk about terms and agencies. Medicaid is the federal name for the program in here in California that we call Medi-Cal. Other states use the term Medicaid. Other states use another term for their Medicaid program. The Centers for Medicare and Medicaid is the federal agency that administers both the Medicare program and the Medicaid program. Every state has to have a single state agency that administers the Medicaid program in that state. That entity in California is called the Department of Healthcare Services, or DHCS. Now, DHCS can delegate some of its responsibilities to other agencies. So, for example, when we're talking about the in-home supported services program, it's a Medi-Cal service. You have to have Medi-Cal in order to ask for IHSS. But the state agency that administers the IHSS program is the California Department of Social Services, or CDSS. When California agreed to take federal money and participate in the Medicaid program, it sent to CMS a state plan which describes the nature and scope of the Medi-Cal program and other things. It agreed to follow federal laws, regulations, and guidelines. If you're interested in seeing the state plan, you can go to that link. Now, there are programs in Medi-Cal where we say that there's federal financial participation. In other words, there are Medi-Cal programs where the federal government is helping to pay for the service or whatever it is Medi-Cal is paying for. But there are also Medi-Cal programs in the state where the federal government doesn't pay for anything. They are called state-only Medi-Cal programs. So we have Medi-Cal programs where there's federal financial participation, and we have Medi-Cal programs where the state is not, the federal government isn't helping to pay for those services, called state-only Medi-Cal. Next slide. There are two ways to get Medi-Cal. Either you're in fee-for-service, and that means that you can go to any doctor in California who has become a Medi-Cal provider. So if I'm living in San Diego and I happen to be traveling up to San Francisco and I need to see a doctor and I'm in fee-for-service Medi-Cal, I can look up any doctor in San Francisco that takes Medi-Cal and go see that doctor. The other form of service delivery is managed care. And the majority of people in California who have Medi-Cal are in a Medi-Cal managed care plan. And these links will take you to some more interesting information about the different models in California of managed care. When you open up these links, in one of the links, you'll see the state of California and all the counties. There are counties in California where there's only one Medi-Cal managed care plan. That's it. You have no choice. You can't go to any other Medi-Cal managed care plan because that's it. So for example, up north, it may be partnership. That may be the only managed care plan available to you. But there are other counties where there might be two Medi-Cal managed care plans. I know in LA, there are about 4 or 5 Medi-Cal managed care plans. So if you live in a county where you have the option of more than one Medi-Cal managed care plan, you can switch from Medi-Cal managed care plans at any time. And so you'll know what kind of model you have if you go to the link. It depends. Like in Orange County, there's Cal Optima. That's the only Medi-Cal managed care plan. And so just a little bit of interesting information if you want to know that. So 2 service delivery models, fee for service and Medi-Cal managed care. Next slide. Medi-Cal services. Sometimes we refer to services as full scope Medi-Cal, that you have full scope Medi-Cal. That means that you can request any of the services that are available under the state plan that are available, right? Doesn't mean you'll get them, because you might have to, at the very least, you're going to have to show medical necessity for what you're asking for. And there might be other criteria for what you're asking for, but full scope. Restricted Medi-Cal is restricted for some event. So for example, emergency. Sometimes people get emergency Medi-Cal and get Medi-Cal to cover the emergency. But once the emergency ends, Medi-Cal ends. You can't use your Medi-Cal for anything else. There's also pregnancy-related Medi-Cal, limited services to the pregnancy, long-term care, breast cancer services. That could be a restricted type of Medi-Cal. So full scope Medi-Cal and restricted. Restricted because of the disability, or in, for example, emergency, for the emergency, and that's it. More information about the difference between full scope and restricted scope benefits are in this link that you can open up later. Next slide. So I'm gonna show you a list of services that Medi-Cal has. It's a pretty inclusive. There's also, the second link is to a manual from NHELP, which is a national organization, and they have a really good manual on Medi-Cal services that you can look at. But let's go ahead and open up this link on the list of services. So Medi-Cal offers outpatient services like doctor services, outpatient service, outpatient surgery, podiatry, chiropractic, dialysis, emergency services, hospitalization services. Could we scroll down? Maternity and newborn care, mental health and substance abuse services, covers drugs, Denti-Cal, you get dental care. They have all kinds, it offers all kinds of therapies, such as acupuncture, occupational therapy, speech therapy, physical therapy, hearing aids, home health services, lab services, preventative and wellness services, pediatric services. You can get vision care through Medi-Cal too. Enhanced care manager, and I'm going to talk about that a little later. You can get transportation services. You can get, whether you're in fee for service or you're in managed care, you can get Medi-Cal to have someone come and pick you up and take you to your doctor and take you back home. If you didn't know about it and you're in managed care, you should contact your managed care plan and talk about getting transportation services to and from medical appointments. There's also a long list of long-term support and services. Medi-Cal will cover for you to live in a nursing facility, in-home supported services, home and community-based waivers. Waivers are extra services to subpopulations of people in California. I do a whole training on waivers. So this is just, it's not an exhaustive list, but it's a good list of the general services available under Medi-Cal. It's a very, as far as the breadth of services, it's very generous. More generous, I think, than in Medicare or many of the private insurance plans. We're going to go back to the presentation. We're going to go to the next slide. Okay, when we're talking about Medi-Cal services, I mentioned medical necessity earlier, because it's not enough for the doctor to send a prescription and ask that your managed care plan approve it. The doctor or the service provider has to show that what you need or what you're asking for is medically necessary. And there are different definitions of what medical necessity means. So if you're anyone 21 or older, the definition of medical necessity is that what you're asking for needs to be reasonable and necessary to protect your life, prevent significant illness or significant disability, or to alleviate severe pain. Anyone below the age of 21 is covered under what I call an umbrella of EPSDT. That stands for early, periodic, screening, diagnostic, and treatment. So people under the age of 21 can get a lot more care than adults who have Medi-Cal. And so the medical necessity standard for anyone under the age of 21 is different. Excuse me. It's broader. All you have to show is that what you're asking for is medically necessary to correct or ameliorate a defect, physical or mental illness or condition. If you want to know more about EPSDT in general, there's some really good publications in these links. Let me give you an example of what EPSDT means for a child. So for example, if it's found that the child needs 3 hours of physical therapy a week, and it's medically necessary for the child, anyone under the age of 21, it has to be given to the child. Once that child or young adult turns 21, that 21-year-old is now bound by the adult standard. And the adult standard for physical therapy may be that you can only have 2 in a month. And so suddenly, young adults and children who had been getting all of these services, they turn 21 and suddenly they're now bound by the adult standards and limitations on services. And they say, whoa, what happened here? Well, that's what happened. You're now considered an adult, and subject to the limitations that adults have on services and frequency of services. And you have not as lenient medical necessity standard. Next slide. So let's talk about some Medi-Cal eligibility basics. Next slide. Okay, so when you're receiving SSI, that's the money benefit, supplemental security income from Social Security. When you qualify for SSI, you automatically get Medi-Cal. And that Medi-Cal that you get, we call it categorically linked to SSI. And that Medi-Cal that you get when you have SSI follows the same rules as the SSI program. So they do look at countable resources and they look at countable income. Other Medi-Cal programs, that's not the categorically linked Medi-Cal program, they look at countable income. They don't care about resources anymore. You need to understand this is very important. Don't get confused. If you're getting SSI, you're getting a Medi-Cal that comes with the SSI, and countable resources and countable income are important. For the other Medi-Cal programs, resources don't matter anymore. The rules have changed. Next slide. So when people used to call me for help with their Medi-Cal, the first thing I would want to know is, what Medi-Cal program are you on? If they were receiving SSI, well, I knew they were getting the Medi-Cal that comes with the SSI and that follows the same rules as the SSI program. That's easy for me to deal with, right? But if they were not on SSI, I would need to know what Medi-Cal program they were on in order for me to give them the correct advice, because every Medi-Cal program has its own rules. Every Medi-Cal program will look at gross income and will have its own deductions to gross income to get to what is called countable income. And that's what the Medi-Cal program, any of the programs look at. It's countable income. But to get to countable income, each Medi-Cal program will tell you what you can deduct from gross income to get to countable income. So I've been told that you can take your Medi-Cal card and take it to a pharmacy and they can give you the code, because every Medi-Cal program has an aid code. The other way you can find out what Medi-Cal program you're on if you're not on SSI is when you first got on Medi-Cal, the notice of action would tell you you're on the Age to Disable Federal Poverty Level program, let's say, for example. No one cares as long as they get their Medi-Cal, right? But every time the Medi-Cal program changes you from one program to another, they have to send you a notice. So looking at your notices of action may help you. But the other way to better do this is probably call the Medi-Cal eligibility worker and ask, what program am I on? What's my aid code, right? And because every year a list of aid codes comes out, DHCS makes it available to the public. And we're going to go ahead and open up the aid codes, because I'm not kidding you, there are 60, 70 more Medi-Cal programs, more than that. We have, I think this document is 70 pages. So if we scroll down to the second page and make it bigger, we start with aid code 01. You see right here, aid code 01. And that's called the Refugee Resettlement Program. These are all Medi-Cal programs. And it's full scope. It says benefit levels, full scope. There's no share of cost, meaning the person doesn't have to pay out of pocket for medical, dental, or vision in order for Medi-Cal to kick in that month. And so, I mean, there are 74 pages. If you look up on top, we're on page 2 of 74. And like I said, every Medi-Cal program has its own aid code and its own criteria for eligibility. So when someone will ask me, well, what happens in, this is what happened to my Medi-Cal, I'm like, well, unless you're on SSI, I'm not going to know what Medi-Cal program you're on. And that's the first thing we need to find out in order to help you, right? Because every Medi-Cal program has its own rules. So I just wanted you to let you know that it's complicated, right? But not impossible to understand. So we're going to go back to the PowerPoint. And we're going to go to the next slide. Okay. When you have the SSI Medi-Cal linked program, and the general SSI rules and income rules is that money is counted as income in the month you get it. And then whatever's left over at the following month becomes a resource. Sometimes you receive lump sum payments like a retroactive IHSS award or a, retroactive SSI or IHSS award. I think I said one of those already. And those lump sum payments usually give you more time to spend the money down before it becomes a resource. So people who are on SSI, who are not aware of this rule, can get into a lot of trouble. Because I've seen these cases where someone's been, keeping money in their bank account after the first month, where it becomes a resource the following month for years. And then suddenly they get a notice from Social Security, from the SSI program saying, hey, you've been over-resourced for the last 5 years. I had this case, and the client that I spoke with, she said, well, I didn't know the rules. I was saving up some money. And I said, oh, no. You're going to, and she had, she was required, she was going to have to pay that money back, that SSI money back 5 years. Who knows what was happened with the Medi-Cal. So you need to be careful, with the Medi-Cal if you're getting SSI and you're getting Medi-Cal, resources still matter. And so if you lose your SSI because you're over-resourced, you're going to lose the Medi-Cal that came with the SSI. You're going to get a letter from the county saying, hey, we're discontinuing your Medi-Cal, but we're going to see if you qualify for any other Medi-Cal program. In the meantime, you'll continue with your Medi-Cal, and then the next letter will be, oh, you don't qualify for Medi-Cal, or you qualify for Medi-Cal under this program. So there's a publication here on lump sum payments that you might want to look at if it is of interest to you. Next slide. So resources, remember, you're getting SSI, you're getting that Medi-Cal that comes with the SSI, resources matter. For other Medi-Cal programs, resources don't matter anymore. There are these publications that tell you what I'm just telling you. So you might want to look at them. Next slide. With regard to SSI and the Medi-Cal you get with the SSI, there's a really great program in California called the Cal-Able program. And if you're on SSI, the general rule for resources and countable resources is that you, as an adult, you can't have more than $2,000 in countable resources to qualify for SSI and the Medi-Cal that comes with it. But if you have a Cal-Able account, you can put up to, and you have SSI, for example, you can put up to anyone can put up to $18,000 in your Cal-Able account, and you can have up to $100,000 in that Cal-Able account, and it will not affect your SSI or your Medi-Cal. There's more to this program. If you're interested in the Cal-Able program, I do a training on Cal-Able, but there's a website here that you can look at for the Cal-Able program. Next slide. Immigration status. It doesn't matter what your immigration status is anymore. Doesn't matter. But you still have to qualify for the Medi-Cal program, right? There are other eligibility rules like countable income, etc. Whatever that program says is the criteria for eligibility, you still have to cover. But they don't care about your immigration status anymore. Some people are afraid of getting Medi-Cal because they think that that's going to be considered a public charge. So when you want to change your status to resident to be a lawful permanent resident, the federal government looks to see if you would be considered a public charge. Usually money benefits account as public charge, but Medi-Cal doesn't. So if you're receiving Medi-Cal, except for when you're in a residential nursing home or a mental health institution, if you're getting that kind of care, it could be considered that you are a public charge, and therefore they can maybe deny your lawful permanent residence application. For more information on all of that, I'm not a immigration expert, but there's information in these links about that. Next slide. Remember earlier on, I told you that there are programs, Medi-Cal programs, where disability is a criterion for eligibility for that particular program. In the Medi-Cal world, there is what's called the MAGI program and the non-MAGI programs. The modified adjusted gross income is the MAGI program. This Medi-Cal program came about during Obamacare. It was a program for certain age populations with countable income below certain federal poverty levels. And it was the first program that I knew of where resources didn't matter. So this was some years ago, right? And then the non-MAGI category of programs, the SSI linked Medi-Cal program, you have to be disabled to get SSI unless you're 65 or older. 1619B is a Medi-Cal program where you have lost your SSI because of work. You might be able to continue your Medi-Cal under 1619B. The PICL and disabled adult child Medi-Cal programs, these are things that happen to people who are on SSI, and they change their SSI is converted to another Social Security program because something happened. And so therefore, for those people, they might be able to continue their Medi-Cal under maybe PICL Medi-Cal or disabled adult child Medi-Cal. There's the aged and disabled federal poverty level, the working disabled program, the medically needy program with a share of costs. If Medi-Cal puts me on the medically needy program, anything, and let's say that my countable income is $2,000, it's above, it could be above any of the other Medi-Cal programs that I may be eligible for. And the only Medi-Cal program I might qualify is the medically needy. And they say to me, well, Maria, you can keep $600 of your money, but $1,400 of your $2,000 is your share of costs for Medi-Cal. So for you to have Medi-Cal every month, you have to pay your share of costs. You have to spend that $1,400 on medical expenses, dental, vision expenses, maybe pay your IHSS provider. If you don't pay your share of costs that month, you don't have Medi-Cal for that month. So this link here, let's go ahead and open it because I want to show you what I mean that by every Medi-Cal program has its own criteria. They tell you what you can deduct from gross income to get to countable income because that's what they care about is countable income. So we go to this website. Income-based Medi-Cal is that MAGI program. But if we scroll down, and there's a list of, go ahead and scroll down some more. Medi-Cal for people with disabilities. Here they are, the programs. So let's go to the aged and disabled federal poverty level program. So that program says that you have to have, in order to qualify for this program, you have to have, if you're one person applying for this program, your countable income, monthly income has to be less than 1,732. It's not your gross income. It's after all of the deductions that the aged and disabled federal poverty level program will allow you to do or to take from your gross income. That's countable income. If you're a couple applying for this program, you can't have more than $2,351 in countable income. But then it goes to say, find your countable income by using the Social Security rules. So they're going to allow you to do there are rules for reducing income. You can reduce for your gross income by any blind work expenses or impairment related work expenses. You can further reduce your gross income by, if you scroll down, your family size. So for any family member that's not applying for this program. So if I have two other family members in the house, I'm going to be able to deduct from my gross income an additional $750, or if they're just two adults, $934 from my gross income. So when you look at every Medi-Cal program will have a ceiling of how much you can have in countable income in order to qualify for the program. But remember, countable income is not gross income. It could be a lot less than your gross income. And if this tells you here that you can also subtract any health insurance premiums that you pay. So if you have Medicare and you're paying your Part B premium and your Part D premium, you can even deduct those from your gross income. And if you're living in a board and care, you can further subtract $315 from your gross income. So this is an example of one Medi-Cal program and how and what the ceiling is for countable income and what the deductions can be from gross income to get to see what your countable income is, to see if you qualify for this program. We're going to go now to the presentation. That DB 101 website is really good. Go to it to understand these Medi-Cal programs better, at least the ones where disability is a requirement. But remember, like what I said before, there are people who have disabilities who are not on any of these programs. They may be on another Medi-Cal program. But if you're a person with a disability and you don't qualify for any of these other Medi-Cal programs, then Medi-Cal will look to any of these programs where disability is a requirement to see if you qualify for those. Next slide. Okay, deeming. The general Medi-Cal eligibility rules is that if a minor, anyone below the age of 18, is applying for Medi-Cal, the income of the parent will be counted as if it were the minor's, and it could actually disqualify the child for Medi-Cal. Remember, when we're talking about the SSI-linked Medi-Cal program, deeming is both income and resources. For any of the other Medi-Cal programs, it's now only income. If I'm married and I apply for Medi-Cal, my spouse's income will count as if it were mine, and may disqualify me. Now I may have my own income that Medi-Cal will consider, and a minor child may have his or her own income that Medi-Cal will consider. That's not deeming, that's just looking at the person's income. But when you're deeming income from another person, when you're considering the income of another person as the applicant's income, that's deeming. So some of you may have heard the concept called institutional deeming. Remember, they deem the income and possibly resources if you are an SSI and you get that Medi-Cal that comes with SSI of the person with whom you live. So a minor living with one parent, it will be that parent's income, possibly resources. So institutional deeming is an exception to the deeming. But in order for that exception to apply, you have to qualify for a home and community-based waiver. There are a handful of waivers in the state of California. Some of these, like the alternate home and community-based alternatives waiver. The second one is actually the DD waiver, which some of you may be familiar with, the self-determination program waiver. These are all waivers that have language in them that says, you Medi-Cal eligibility worker, if this person qualifies for this waiver, then you are going to apply institutional deeming. You're going to pretend that the applicant, say here the minor, is living in an institution, and therefore you don't deem the parent's income because you're pretending that the child is living in an institution, and so you're only going to look at the child's income or the spouse's income. That's what institutional deeming is about. There is no such thing as an institutional deeming waiver, doesn't exist. It's a concept that Medi-Cal eligibility workers use to not deem. If you want to know all of the waivers in California, past and some present, some past waivers, but more importantly, the present waivers, you can go to this link and you can read all about them. I also do a training, like I said, on these if your group wants them. Next slide. When you get Medi-Cal, you also get Denti-Cal. And so you can go to this link and learn about Denti-Cal. I believe that if you're in Sacramento and LA County, you're in a Denti-Cal program that's like an HMO program, but otherwise you get to choose your providers. So lots more about Denti-Cal in that link there. Also, next link, next slide. If you get Medi-Cal, you also get vision care. So if you're interested in knowing more about vision care, you can go to the link that is there. Next slide. So what happens when you have Medi-Cal and other health coverage? Medi-Cal will always be payer of last resort. What does that mean? It will only pay for expenses that it covers and that other coverage will not. So when if I were to go to Medi-Cal and say, hey, I need a power wheelchair, and they know I have private insurance and I have Medicare, they're going to say, no, you have to first go and exhaust your private insurance and then your Medicare before you can come to us. And that's the way it works. You can have all of this, you can have there are children who have private insurance, who may have California Children's Services and have Medi-Cal, but Medi-Cal will always be payer of last resort. It becomes complicated when you have different insurances, right? Because Medi-Cal is saying, no, you have to go exhaust that. Some parents of minor kids will use the private insurance to have access to providers who don't take Medi-Cal, right? And so, and keep Medi-Cal for other things. You know, there are ways to do this. So that's how it works when you have Medi-Cal and other health coverage. And in fact, when you apply and in the redeterminations that you get every year for Medi-Cal, they do ask if you have other health insurance because they, you know, because if you do, they're going to always say to you, you have to go exhaust the other insurance before you come to us and ask for things. Next slide. So I want to briefly go over the Cal-AIM program. It started in 2022 and through 2027. This whole thing is to try to improve health outcomes for people who are on Medi-Cal, to make the services more standardized and equitable throughout the state, to ensure that people who need the most help are getting it through proactive outreach, and for the first time combines medical care with new non-medical services, including medical respite, personal care, meals, housing. Talk more about that in a moment. So let's look at some of the changes that happen. Some of these may not even be important to you or you may not care, but I just listed some of the things that have changed. Next slide. So Department of Healthcare Services and managed care organizations enter into contracts. And in that contract, the managed care organizations specify what they're going to cover under Medi-Cal. If they don't cover things that Medi-Cal covers, then Medi-Cal will still cover it, but it's not going to be paid for with managed care money, right? But in January of 2023, skilled nursing facility care is now the responsibility of managed care plans. More information on that. In July of 2023, specialty mental health services are now you can only access them through county mental health plans. These are services that Medi-Cal will pay for, but you don't go to your mental health. You don't go to your managed care plan to get them. You would reach out to county mental health. These are for specialty mental health services are usually for people who have, you know, complicated mental health needs. There were some people in 2022 who were in fee-for-service, who were forced into managed care. And there were some people who were in managed care who were moved into fee-for-service. So those are some of the things that happened. If you would know if it happened to you because you would have gotten a notice. Next slide. Dual eligibles. When we talk about dual eligibles, we talk about people who are getting both Medicare and Medicaid or Medi-Cal. And one of the possibilities for getting care is to have your Medi-Cal managed care plan take over your Medicare. So everything is under one roof. Why? Because there could be better care coordination. So if I decide that I want my Medi-Cal managed care plan to take over my Medicare, I get all of my services through my Medi-Cal managed care plan, but they're managing the Medicare too. So I don't have to worry about another Medicare, Medicare, original Medicare being involved or another Medicare Advantage plan being involved. It's all under one roof. More information about these options are in this link. More information about Cal-AIM is in this link down at the bottom. Next slide. Enhanced care management is really important. So in 2021, the beginning of the year, all managed care plans are required to provide this service. It provides additional support for persons in managed care with complex health needs. You can read all about it here. If you think that you qualify for enhanced care management, reach out to your managed care plan and ask for it. The other thing is the other service is called community supports, also known as in lieu of services. This is optional. The managed care plan does not have to offer these services, but these services includes perhaps housing, food, community transition services, things that are typically were not within the realm of Medi-Cal because they weren't medical services. If and there you could read more about these types of services, and you should reach out to your managed care plan to see if they provide any community supports / in lieu of services. There were some new dental benefits that came about, and you can look at the link for more of that. Next slide. This is the dual eligible page again. It's just a repeat, so we can go on to the next slide. Applying for Medi-Cal, you can apply, you can submit the application, walk into your local Department of Public Social Services and do it. You can actually, let's open up that one, and we're also going to open up Benefits Cal. It's a lot easier now to deal with the counties and do a lot of work, a lot of interaction with the county through the Benefits Cal website, which we're going to show you in a moment. But I wanted to open up the publication on applying, so that there are different ways to apply for Medi-Cal. If you want to scroll down, this is I don't know why this link opened up, because the link is different. So apply for Medi-Cal. Why don't you click on apply for Medi-Cal? That's on, there we go. You can apply online for Medi-Cal. You can Benefits Cal, and we're going to go to that. Can you scroll down some more, please? You can apply by mail, and you can apply in person. So those are the different ways of applying for Medi-Cal. Now we're going to go, let's go to the Benefits Cal. So Benefits Cal is available to everyone in the state of California. It's fantastic. I can apply for any benefits that the county administers. So if we go to programs, other programs, so these are the programs that the county administers: CalFresh, Disaster CalFresh, Medi-Cal, County Medical Services Program, CalWorks, General Assistance, General Relief Opportunities for Work, Refugee Cash Assistance, Trafficking and Crime Victims Assistance Program, Welfare to Work Program, Cash Assistance Program for Immigrants. So through this portal of Benefits Cal, I can apply for any and all of these benefits if I want, and I can do it online. I can actually create an account. So you see right up below login, I can create an account for myself. I'm going to create a username and a password, and that way I can apply for benefits. Once I'm on a benefit, I can download documents through Benefits Cal. I can communicate with my social worker through Benefits Cal. I can get notices about my benefits through Benefits Cal. So it is a wonderful way to do things, a lot easier than it was in the past. So don't forget about this. You can apply and manage your benefits online. No longer do you need to walk into the county welfare office to hand a document in. You can do it online. You can apply online for any of these programs. Okay, we're going to go back to the PowerPoint. You can call and apply. Okay, next slide. So the Benefits Cal is right there for you. Additional resources, if we come to the end of the presentation, there's this wonderful manual from Western Center Law and Poverty on Medi-Cal eligibility. Lots of wonderful information. Beware though, it was published in 2026, so it has 2016. So it has 2016 federal poverty levels. And so we're in 2024. So if you're going to use this manual, use the 2024 federal poverty levels that I've included here. And some things have changed since 2026, like immigration status, resources. So there have been changes to the Medi-Cal eligibility, to Medi-Cal eligibility that won't be reflected in this manual, but it has a lot of good information that's still good. And if you have any questions, you can always reach out to us. You can also reach out to Health Consumer Alliance. They provide assistance with, Medi-Cal. They've got a website with information. Healthcare Options is a nonprofit. It's an entity that helps you. Like, let's say I'm on Medi-Cal, but I don't know if I'm in managed care, if I have fee for service. I can call Healthcare Option and they can tell me. They can even, if I'm in managed care, they can tell me who my managed care plan is. They can tell me if I have Medicare, or if am I in an original Medicare or Medicare Advantage. Let's say that I'm in a county where I have the possibility of more than one Medi-Cal managed care plan. I can talk to them about, hey, you know what? I'm thinking of moving into this other plan, and these are my needs. Do you think this, would this be a good change for me? And they can talk to me about it. So there are a lot of things they can do to help you with your Medi-Cal managed care. There's also an office of Medi-Cal managed care Office of Ombudsman if you're having trouble with your managed care plan. We also have a publication. We have publications in our resources section of our website. One in particular is Medi-Cal Managed Care Appeals and Grievances, really important publication. We're going to put the link in the chat. You need to know what your grievance and appeal rights and how to do it with Medi-Cal Managed Care, and the possibility of going to another state agency called the Department of Managed Healthcare to get help when your managed care plan is not doing what you think it should be doing. Lots of good information there. So we have come to the end of the presentation, and I'm happy to take questions or comments.
Can we stop the recording?
Yes, I'm going to stop the recording.